Good afternoon, everyone. I welcome all of you who have joined in on Parentune from the site, from the Parentune app, and from our social handles, including Facebook. I hope you're doing really great. And on the eve of Mother's Day, I am really happy to be bringing this live session to all of us. And the last 2.5 months have been challenging for all of us. And in these challenges, one of the bigger challenges have been to take care of the little ones. And I really want to congratulate all the parents who've done such a fantastic job. And we've been hearing those stories on Parentune from you. Today, we are joined in on another important topic, which we'll be covering in this live session. And that is about vaccination during pregnancy. Now, while lockdowns have been challenging, independent of lockdowns, I think there's a lot of lack of awareness about the importance of vaccination during pregnancy. So today in this session, we'll be covering about the importance of this whole aspect of vaccination during pregnancy. And for that, I have also been joined in by a very senior expert. I'll be introducing her to you soon. But just before that, I would like to thank GlaxoSmithKline, who has supported us in bringing this live session to you today on Parentune as well as Parentune social handles. Now, let me introduce today's expert to you. We today have with us Dr. Meeta Singh, who's a senior obstetrician and a gynecologist. She has more than 35 years of experience, and she is also the president of the Indian Menopause Society. She's published a lot of papers, many research papers and journals, and she's recently published an influenza vaccine research paper, which has also been acknowledged and appreciated by WHO. So today I have Dr. Meeta with us for this live session. I would like to welcome Dr. Meeta. Dr. Meeta, over to you.
Thank you, Nitin. A very good afternoon to all the viewers and namaste. So thank you for joining us. I hope you all had your lunch and also a cup of tea, because that makes you very fresh to listen to what I have to say. And it is, like Nitin said, a very difficult period for all of us, but I must thank, and I think, but we are living in a very, in an era where the communication is so easy. With the click of a button, we're able to do so many things, expose ourselves, interact, meet, even with the social distancing and lockdown, life is still going on and we are able to function in so many ways. So having said that, I would definitely like to thank Nitin and Parentune for this, wonderful opportunity for me to convey my thoughts on this very important aspect, which I feel very strongly about, that is vaccination in pregnancy. And so we're going to discuss how we're going to take it forward. As first, I'm going to talk to you a little bit about what this really means. Then all the viewers, all the parents who are tuned into this program can send in their questions and I'll be more than happy to answer them. But I would make one request, that it is better to restrict your questions to vaccination in pregnancy and the doubts which are around them, rather than general questions which would cover the rest of the pregnancies, because then we can be more focused in this particular area and spend the next 45 minutes of good question answer session on vaccination. You can definitely ask me questions on vaccination apart from pregnancy. It's otherwise also related to post-pregnancy or pre-pregnancy. I would be very happy to take them in. So now let me just give you a little briefing about what vaccination really means. I'm sure all of you will understand when we say vaccination. Vaccination is given to prevent a disease, to prevent a problem. And I put it very, very specifically as a disease and not an infection alone, because we have a lot of vaccines in the market which are available to mankind. And when you say vaccination, generally people think that it is only to be given for babies. But we have moved away from that. Last 20, 30 years, there is a massive change in the thought process and in the availability of the vaccines that we have. We have become much more powerful in this area, in the sense that vaccination is not only effective against infections. I'm sure all of you think when it is vaccination, it's only infection. We have certain drugs which prevent infection or cure diseases, but we have some vaccines which even prevent cancers. So that's a very big area, which I'm going to talk to you about a little later, because the topic of conversation today is mainly during pregnancy. Now, during pregnancy, when we talk about vaccination, everybody knows and everybody thinks that they have to take tetanus toxoid. I mean, that's ingrained. And that's a wonderful thing to have happened, because years ago, maybe about a century ago, when the children were born at home, when home delivery used to be maximum and hospital deliveries were less, people used to use cow dung, and so many other things for the cord. And that is when babies used to have this neonatal tetanus and neonatal problems. So tetanus is a neurological disorder, and this was causing a huge problem. And we used to have a lot of these neonatal deaths. And of course, there was so much of tetanus which was happening even for the woman. So it was a two-pronged approach at that time. That is when a tetanus toxoid was given. And those days there were 3 doses that were given, because they didn't have a primary vaccination in the earlier period of their life. So we were giving 3 vaccines, 3 doses, and 3 doses to protect the mother from tetanus, and the antibodies which are generated by the mother will travel through the placenta, go to the baby, and protect the baby for the next few months till the baby is capable of generating its own antibodies. Here you should understand that the mechanism is a little different for the newborns when you compare it with the mother. The mother, when you're giving, or any adult, when you're giving a vaccine, immediately the body responds. That means you are injecting a antigen, that is an infectious agent, which is not going to cause an infection, but it is going to inside the body to produce some antibodies. Now these antibodies will stay with you for lifelong and prevent that infection. So that is the basis of vaccination. But in a newborn, the first 6 weeks, unfortunately, the immune mechanism is not developed. So what happens is that small babies till 6 weeks cannot develop their own antibodies. So that is a very vulnerable time. That is the time when the baby can catch infections from anywhere. And that is the time when the baby needs real good care. Because after 6 weeks, then you give the DPT, and then you have so many vaccinations. Now you have a whole lot of vaccination programs which are there after the 6th week of the baby's birth. But what is very important is protection during this vulnerable time. So we're going to talk about that now. So we have moved away from only a tetanus toxoid to something which is much more available to us, because earlier, now how many of us see a tetanus nowadays? Hardly. The number of cases have reduced drastically. We hardly ever see tetanus cases today. But I remember 35 years ago, when we started our practice, we would see cases of tetanus. They were tetanus. So the importance of that vaccination was there very much at that time. It is not so much today, but we still give it, because we don't want any case to be there. We want no case in India. And that is why we still continue to give the tetanus toxoid. Now, what is more important and what is relevant today are 3 important infections which are happening and which can be prevented. Now, before I move on to these 3 important infections, let us talk about COVID, which is there. Now, COVID, luckily, is not so bad from whatever 6-8 months experience that we have. We don't have a huge experience, but whatever medical literature is there in the past, say from December till May, November till May, the medical literature says that the women are not that badly affected by COVID, even if they catch an infection. And luckily, in the later half of pregnancies, the few women who have had this infection, it didn't really pass on much to the baby. And the women also did fairly well. So we have to wait till we develop a vaccine where we can, and then see whether that is safe in pregnancy, and then it has to be given. So that's about the COVID infection, which is going on now. Now, we had a similar situation which we faced when the H1N1 came in. So if you know what an H1N1 is, it is swine flu. It goes by the term swine flu. And we know the havoc it created about 5-6 years ago. There was a huge pandemic and people were dying with swine flu. And I personally had an experience of a young girl with whom we didn't know why she suddenly went into respiratory distress and end organ failure. within a week after her delivery. And she just was complaining of cough. And then we realized that this is a new disease which has come in, and that is swine flu. And this causes a worse scenario in the woman. So that is the difference between the COVID and influenza from what I am looking at, because I have experienced that. And I know swine flu, vulnerable age groups are the young children, the old people, the immunocompromised, and the pregnant woman. So the pregnant woman can die more if they catch an infection because of influenza. So what we started doing was the CDC, that is the American organization, they had given a green chit to give the influenza vaccine, where our organization in India had not yet thought about it at that time. And we started working on it because of one experience which was enough for us to shake up totally. So we started giving influenza vaccine at that time during any time of pregnancy, and that is how we were able to come out with a paper for more than 500 or 700 cases which we have published at that time. Now we have very happy with it, because at the end of the whole thing, when we analyzed our data, we found giving influenza vaccine had a protective effect on the mother. She didn't develop the infection, and that continued for the baby for another 6 months, till the baby was capable enough to take the influenza vaccine. So here we are protecting the mother, we are protecting the baby. So that really convinced us that vaccination during pregnancy is very, very important. As important as your antenatal visits, as important as taking your iron and calcium. So the influenza vaccine can be given at any time during pregnancy. Now we come to the other vaccine, that is tetanus. We know that we are still continuing to give because of the reasons that I've already told you. The other two ones is the diphtheria and the pertussis. Now diphtheria, what does diphtheria do? Diphtheria actually causes this throat infection. Now when it causes this throat infection, there is this huge, there is a lot of swelling, and you will not be able to breathe. And then it can be catastrophic sometimes. So that is what is diphtheria. And this is preventable by a simple vaccine. So that's about diphtheria. What is pertussis? When you think about pertussis, the colloquial name is the whooping cough. The small children, and generally the reservoir of infection can be anybody. It can be the old people, it can be the adult, it can be the adolescent, but the presentation or the severity of the disease that you have of pertussis would be more in the young children. And like I said, that remember that vulnerable group I said, the first 6 weeks, where they are not exposed to the antibodies, where they are very, very vulnerable because they don't have the capacity. Even if they're attacked by an infection, they don't have the antibodies which they can develop or produce on their own and ward off those infections. So the antibodies which are there for them are the ones which have come from the mother through the placenta. So that is still protecting them in the first 6 to 8 weeks of their life. So it's only after that that they start producing their own antibodies, whether to a natural infection or to any vaccination that we're giving them. So pertussis, now pertussis can be really, really bad. What happens is these small children will start developing this cough, and that goes into a whoop. The way it sounds is a whoop, and there are fits of those coughing spells, and the baby turns blue. And you know how bad it is when the baby turns blue. It's very, very frightening if you've ever seen a case. And India is kind of leading in pertussis in the world. So people are not aware, but pertussis is bad in India. And definitely we need to protect our children from this disease, because 95% of the children, if they are affected by this pertussis, they will need hospital admission. And about 1 to 2% of them can die. So that's a huge number. And these are all preventable by a simple vaccination. So that is why I have a strong belief that vaccination is very, very vital during pregnancy, just like your pap smears for your cervical cancer, or a breast examination for a preventive medicine, what we call as a preventive medicine. So this preventive medicine has a very important role to play in the health of the entire community. So how does it act? And how does the small baby get the infections, and how does it protect? Yeah, suppose now, when do we give it? Maybe I leave these questions for the questions to be asked, or what, Nitin, you want me to compete a little more, or you think we should leave something for the question answer session?
I think some questions are coming, Doctor, on this. So I think it would be really interesting to also start taking questions.
Yeah, so you want me to stop over here and take questions, or I can go on talking for some more time?
So I think let's take some questions, ma'am, now.
Okay,
And whenever you want to talk about this again in more detail, we'll also be doing a conclusion towards the end of the session. So I'll make sure that we keep
sure.
10 minutes just around that, so that you, if we miss out anything
Yeah,
important, you can highlight.
maybe two sentences which I think people should understand is when we are giving this vaccination, when we give the vaccinations, na, pertussis has to be given between 28 to 36 weeks of pregnancy. So the explanation we'll leave it later. And so the baby is protected. And sometimes we may need to also protect the environment. So we'll leave that for the question answer session.
Right. Dr. Meeta, thank you again so much for bringing the entire aspect of vaccination during pregnancy. I think it's not spoken as much as it should be, and like you said, the cases of pertussis in India, we lead those, so it becomes even more pertinent to look at this entire thing with much more seriousness. For everyone who's just joined in the session from Parenthood, I would just like to welcome you for this live session. We are today talking about vaccination and its importance, especially during pregnancy. I am joined by Dr. Meeta Singh, who's a very senior obstetrician and gynecologist, and she is now ready to take your questions. So let your questions come in the comment section, either on Parentune or our Facebook handle. So feel free to share your questions. In case we are not able to answer your question, the chances are that your question has already been answered or it's going to get answered. So be there through the session, and your question will certainly get answered. So Dr. Meeta, the first question which has come in from Vidya Sagar, and she's asked, when is the vaccine for whooping cough, pertussis, has to be given, and is it compulsory?
Yeah. So there are two questions in your question. One is whether it is compulsory. Yes, I think it is compulsory from the explanation that I have given you. And when it has to be given, it's not only pertussis. So one is the influenza vaccine that I have told you, that we can take it anytime during pregnancy. You can take it in the first trimester, second trimester, last trimester. The efficacy and the protection is there for the baby after delivery as well. Whereas it's not just pertussis, we give Tdap, that is tetanus, diphtheria, and pertussis all together. So we don't give them separately. We give all three of them together. That is TDP. That is Tdap, it is called. And ideally, it is to be given between 28 weeks to 36 weeks of pregnancy. And here I'll go a little bit more and explain why it has to be given like that. Though it can be given up to 1 week before delivery if you have missed it. But the best results, that is the best antibody titers, or what we say the protection for the baby, is seen to be when this injection is given during this time of 28 weeks to 36 weeks.
Thank you, Dr. Meeta. The next question is from Priya. She is asked, when should she take tetanus injection during pregnancy, and how many?
Yeah. So Priya, I personally have moved away from giving the TT injections, and but if you are still interested in taking only tetanus, I would strongly advise, because the global organizations, the Indian FOXI, that is it's a very huge obstetric organization, all of them have moved away from only single tetanus dose, and they are moving bent more on the Tdap for the reasons that I've already alluded to in my earlier talk. So I think it's a good idea to go for a Tdap single dose between 28 to 36 weeks. But for some reasons, it is not accessible or it is not available in the place where you are in, and you would still like to go ahead and give your tetanus, then we are only giving 2 doses. And you should be ideally taking it around 24 to 26 weeks, and 6 weeks later, the second dose. So 2 doses are given. And if you have already taken your tetanus toxoid complete dose during your non-pregnant times, then only 1 dose is sufficient. You don't even need to take 2 doses of tetanus. So that is the actual regime that you should follow if it's only a tetanus toxoid.
Thank you, doctor.
Right.
The next question is from Rani. She is in her 7th month of pregnancy. So here is what she's asked. She's taken her first tetanus shot 2 months back on the 4th of March. And she's asking that can she get her next tetanus shot? And also, she's taking hem up capsule and shell cal. And she's taking shell cal HD. And her HB value is 9. She's also asked for tips to improve her HB levels.
Yeah, so that's actually not part of the session that we have in today. So I will first answer your question on the injection, but I don't know from which areas these questions are coming in, but I'm quite surprised that that means the awareness is not there, because everybody is still talking about only taking the tetanus dose. You can take the tetanus dose now, but nobody is saying that I have taken you're willing to take the Tdap. So even if you have taken a single dose of tetanus, say in March, you can still go back and take your Tdap now. So that will cover the second dose of tetanus and also cover you for diphtheria and pertussis. And I would strongly advise you to do that rather than take only a tetanus dose. As far as your hemoglobin is concerned, 9 grams is of course very bad, while if you're on a regular antenatal checkup. So first, generally it is nutritional anemia. That means because you're not taking enough, either you're not compliant with your iron tablets, or you're not taking a good iron rich diet. So I think you should be taking a good iron rich diet, one, and you can increase your medication to 3 capsules per day. But I would suggest that you go back to your obstetrician and discuss this more at length. But you should be having 12 grams at least, if you want your baby to be nice, healthy, and you to be healthy.
Right.
Otherwise, there's no point in going for an antenatal checkups if you're anemic.
Right, right. So, Rani, you heard from Dr. Meeta. So, do not get anxious, do not get worried, but do as she has advised you, and I'm sure your hemoglobin levels will go up. So, take good
Yeah,
care.
that doesn't take time. That doesn't take time. If you really work on it, 2 weeks, your hemoglobins can be 12.
Okay. Thank you, Dr. Meeta. So, Rani, please take care, and all our good wishes with you. For everyone who's joined in the session just now, I'm joined by Dr. Meeta Singh today, who's a senior obstetrician and a gynecologist. She's today addressing vaccination during pregnancy, and we've already started answering questions. The next question is from Shruti, who's in her 6th month of pregnancy, and she wants to know that when can she take the Tdap shot, especially when she has already taken the tetanus shot uh, in the first 20 weeks of her pregnancy. Also, with the current COVID scenario, she is asking that what kind of precautions should be taken while she goes for her scans, tests, and for the vaccination.
I think that's a very good question, a very practical question, which everybody is following. So what we have done is we have actually, perhaps Parentune also can come out with this thing on what precautions need to be taken when you go for your examination at this time. So most important and very simple thing is distancing, distancing, and distancing. Protection and distancing are the only 2 mantras that we need to follow. Protect yourself and social distancing. So when I say protect yourself, it means that you're protecting yourself from the aerosol, because it's this aerosol which is causing these infections. So you have to wear a complete mask. And in fact, you can wear the plastic shield when you go to the hospital. So if you've got a plastic shield, which is easily available, and I'm sure it's all there on the WhatsApp, how to make one, if you're not there, and it's available everywhere in the market. So wear a plastic shield, wear a mask inside, and you're protected from any infections from outside. And always have a sanitizer with you. Try not to touch anywhere when you're going to the hospital. And at the hospital also maintain a distance of at least 3 meters from anybody who are not with you. Like not, and don't take not more than one person from your family should be going in to the hospital. So that would be the best thing to do. And at the hospital, maintain this decorum of social distancing, your protection, your hands don't touch anywhere. You keep a sanitizer, even if inadvertently you're touching the chair or holding something, use the sanitizer. And I'm sure most of the hospitals now are screening at the entrance itself. So go through that entire process before you see the doctor. And with the doctor also, we are trying to maintain the 3 meters distance. Even if you're going for a scan, keep your face covered. keep your face covered, avoid touching anything. And I think these are the most important measures that you have to take.
Right. And for Tdap, ma'am, when can she take that?
Yeah, I think Tdap she can take, I said 28 to 36 weeks. So you have a long time. If for some reason you're not able to go and see your doctor, you have time till 36 weeks. Even if that doesn't happen, even 1 week before delivery, you still have a lot of protection. So you don't need to take a second dose of tetanus. You just take the Tdap.
Right. Thanks for giving this clarity. So Shruti, you know what needs to be done. Ma'am, can you explain a little more about the Tdap vaccine, and if you can talk a little more about that, is a question which has come in from Sagar Suresh.
Yeah, can you just ask him, because I've given a little briefing about the Tdap, so I don't want to repeat what I have said.
Right.
If he can be a little more clear in exactly what he wants to know about it, then we can come back to that question. So it's more focused.
Right. I agree with you. So like Dr. Meeta has mentioned earlier in the session, Tdap vaccine is ideally to be given between 28th week to 36th week. And, that's the ideal time to give that vaccine. And, do elaborate your question a little more, Sagar, and hopefully we'll be able to get your question right. Punish has asked, and this is 25th week of pregnancy, and has asked in Hindi, ma'am. So it is, she's saying that मेरी 25 वीक की प्रेगनेंसी है, क्या मुझे वैक्सीन लगवानी चाहिए और क्या कलर्ड अल्ट्रासाउंड 7th मंथ में करवाया जा सकता है और करवाना चाहिए?
अच्छा, ये बड़ा इंटरेस्टिंग सा क्वेश्चन है. तो हम मतलब हर क्वेश्चन में आपके 2 क्वेश्चंस है, हाँ, व्हाट नितिन? तो आपके हर क्वेश्चन में 2 क्वेश्चंस होते हैं, तो कोई बात नहीं. तो आपका जो है अभी 25th वीक है, तो जब भी आप डॉक्टर के यहाँ जा रहे हो, आप एक इन्फ्लुएंजा वैक्सीन जरूर लेना है. इन्फ्लुएंजा वैक्सीन ले लीजिए. एंड 28 वीक्स, दैट मीन्स आपका जब 8th मंथ में 28 वीक से 36 वीक्स के बीच में Tdap ले सकते हैं. अगर बाई सम चांस आपको 28 वीक तक आपको हॉस्पिटल के लिए जाने के लिए तकलीफ है या नहीं जा पाएंगे, तभी कोई तकलीफ नहीं है. आप ये दोनों वैक्सीन एक ही साथ ले सकते हैं. मतलब एक दिन में एक टाइम पे आप दोनों भी वैक्सीन ले सकते हो, इन्फ्लुएंजा और Tdap वैक्सीनेशन. अब सवाल रहा कलर पिक्चर का. कलर पिक्चर इज फॉर जनरल पीपल इट्स मोर ऑफ एक अपना इंटरेस्ट है. मेडिकली हमको जो 2D में जो मेडिकल इंफॉर्मेशन मिलता वो काफ़ी है एक्चुअली. 3D में क्या है, आपको चेहरा नज़र आता, हर चीज़ आपको कलर में नज़र आता, तो वो पेशेंट्स के लिए बड़ा इंटरेस्टिंग है. 3D में कभी कभी जब हमको 2D में थोड़ी जगहों पे जहाँ कुछ डाउट आता है, तो बहुत ही रेयरली 3D हमको डायग्नोसिस में हेल्प करता है. 2D में अच्छा सा 2D अल्ट्रासाउंड में हमको सारी इंफॉर्मेशन आ जाती है. 3D देखने में बड़ा अच्छा है, तो आप कभी भी ले सकते हैं. एंड 3D पिक्चर्स एक्चुअली बेस्ट पिक्चर्स आपके फर्स्ट 3 मंथ्स में, 5th मंथ में, 6th मंथ में, जब बच्चे के अतराफ पानी ज्यादा होता है, तब आपको बड़ा सा अच्छी फोटो आती है.
Thank you for answering that in Hindi, Dr. Meeta. Really appreciate that. So, Punish, आपको पता है अब क्या करना है? तो Dr. Meeta ने जैसे आपको advise किया. For everyone who's just joined in the session, I'm joined with Dr. Meeta, who's taking today questions on vaccination during pregnancy and the importance of it. Rashi, in her 2nd month, has asked us, can we take Rubella vaccine during the 2nd month of pregnancy? She's had 2 miscarriages earlier, and she's pregnant now. She also wants a suggestion to know what are the kind of vaccinations she should take now.
Yeah, rubella is an absolutely no during pregnancy. You are not supposed to take rubella during pregnancy. In fact, हम जो infertility patients होते हैं या जो pregnancy के लिए try करते हैं, कोशिश कर रहे हैं pregnant होने के लिए, we will ask them to get a rubella IgG, IgM done, to understand whether this particular woman has been immunized during for rubella or not. If she has not been immunized, we would, especially for patients, now you're pregnant, so that's very lucky for you and good for you and all the best. But people who are trying for a pregnancy in between their losses, we would suggest them to take the rubella vaccine so they get protected by rubella and not get pregnant for the next 3 months.
Right. Thanks, Dr. Meeta. The next question is, I think, from anywhere in your neighborhood in Hyderabad. So Dr. Meeta is stationed in Hyderabad. Sindhu Reddy is asking a question. She is in her 36th week, and she's mentioned that her gynecologist offered her only tetanus vaccine and told that no other vaccine is necessary right now for her, no other vaccine. So is this correct to do? And what
Uh,
other vaccines
yeah.
does she need to take?
What other?
Vaccines does she need to take, especially now that she is in her 36th week?
Yeah. So 36th week, this is the global advice that we have. That means, this all the organizations all over the world. And Foxy is our organization, obstetric organization from India. So the advice from these organizations is we need to take two vaccines. One is the influenza vaccine and the other is the Tdap. So if you're taking the Tdap, you don't need to take the tetanus because Tdap will have both tetanus, diphtheria, and pertussis. And 36th week, you can take both of them. So I would suggest that you take both of them.
Thank you, doctor. The next question is from Ayan, and he's asked, is swine flu vaccine really necessary to be taken during pregnancy? And which are the other vaccines which have to be taken for sure?
Yeah, so I strongly feel that swine flu vaccine needs to be taken during pregnancy because pregnant women are very vulnerable in the sense that if this influenza affects during pregnancy, the chances of them getting into complications is very high versus non-pregnant women. So when a woman is not pregnant and she catches the influenza, the disease is not so bad. But if she catches it during pregnancy, we can even lose this particular woman. So it is that bad. So, so protection is very, very important. And I think slowly it should be mandatory to take the influenza vaccine.
Right. Thanks, Dr. Meeta. Thank you. So the next question is from Vinita. And she would like to know what are the vaccines which should be avoided during pregnancy. And this is a very interesting question.
Good. So I think that's a great question you have posed. Like I already told you, these are the only vaccines which can be given. That is the influenza, the tetanus, the diphtheria, the pertussis. And mind you, even in these, there are different types of diphtheria vaccines. There are different types of pertussis vaccine. So all the pertussis vaccine cannot be given during pregnancy. So the ones which are prescribed during pregnancy can only be given because the pertussis which is given for children cannot be given for the pregnant woman. Similarly, the swine flu vaccines also different kinds. So the ones which can be prescribed in pregnancy only should be given. So that is very clear. Like rubella, absolutely no. The other vaccine which can be given in pregnancy is the hepatitis B vaccine. So if somebody has not been immunized, you can still take the hepatitis B vaccine. But normally we would expect everybody to be vaccinated by hepatitis B because now it's a part of the childhood vaccination. But if somebody is, say, more than 30, 35 years, where at that time, children were not offered hepatitis B vaccine as a part of a vaccination program, then they need to be immunized. So I think this problem is a little less now because most of the people are immunized with hepatitis B. Now, coming to HPV vaccination, the cervical cancer vaccine, if you have already taken a vaccine or if you have accidentally taken the vaccine, there is no harm. You can still continue the pregnancy, but we generally wouldn't want somebody to take a HPV vaccine during pregnancy. We would want you to deliver the baby. Then in my practice, I generally ask all the women who have not taken HPV to take it at 6th week. When they come for the baby immunization, I say get immunized for cervical cancer. Take your HPV vaccination. Take your hepatitis B vaccination because these two prevent cancers. The rest all should not be given because most of them are live vaccines. So all of the vaccines don't take during pregnancy.
Got it. Thank you, Dr. Meeta. Radha is asking for her sister who is in her 25th week of pregnancy. She's asked that how do we cope up with the vaccination delay because she feels that her sister may miss out the vaccination which is coming up and she's worried about that. So what is your advice for that?
Yeah, at 25th week, you just don't have to worry. I think what's more important is stay at home, stay safe. That is very, very important. And once you're comfortable enough to go to the area, because now we have so many red zone areas, containment areas. So if you fall into any of those groups, please go as to what the government is advising you. There is no urgency for the vaccination. Vaccination can be done even at the 36th week. You can have both the vaccinations done together. No hurry at all.
Got it. Shilpi is asking for 20th week. Can she give pertussis vaccine earlier than 20th week?
No, not at all. Because not that it's going to cause any harm, but the benefit is going to be very less. So the best benefit of the Tdap vaccination is after the 28th week, before the 36th week. That doesn't mean the benefit doesn't extend till delivery. If you have missed out on this between 28th week to 36th week slot, the other time also, but the antibody titers or the protection to the baby may be a little lesser, marginally lesser if you take it after the 36th week. But even a week before delivery, you can still take it if you have missed out on the vaccination.
Right. For everyone who's just joined the session, would like to mention that we are joined with Dr. Meeta Singh, who's answering all questions on vaccination during pregnancy and the importance of vaccination during pregnancy. The next question is from Himanshu. He's asking that what are some of the must-have vaccinations for his wife, and she's 3 months pregnant. Sometimes it is difficult to get the proper information. Himanshu, we just answered that question. So all you need to do is just look at the first 40 minutes, like the 25th minute to 40th minute of this video, and you'll find the answer to your question. Anamika has asked that are TT injections required throughout the pregnancy, because she's been told by someone that you need tetanus injections throughout the pregnancy.
No, actually, we wouldn't give tetanus till the 24th week of pregnancy at least, because if you want the antibody titers to be more for the baby after delivery, it is better to take, like I said, if somebody has already taken tetanus injection before pregnancy, that means they're already immunized. They have the enough of antibody levels in their body. Then they take the injection, only one injection around the 28 to 34 weeks again. So the antibody titers for the baby is there. We are not expecting any woman to get a tetanus, unlike, so I feel today's world, forget the tetanus. No pregnant woman is going to die of tetanus today's world, but a pregnant woman can die of influenza. So take the swine flu vaccine over the tetanus vaccine. And I've already told you when to take the tetanus.
Right. Thanks, ma'am. Mehek has just discovered that she's pregnant. She's in her 4th week of pregnancy. And she's asked that, is there any vaccination as such she should be taking right now in the coming, few weeks of pregnancy, or she can wait for later? And what week does, should she start looking at pregnancy vaccination?
Yeah, actually, anytime during pregnancy, I would go for influenza vaccine. That is what the CDC has recommended. That is the American authority and even the Foxy now. So we can take the vaccine anytime when you go to the clinic to see the doctor. So maybe after the 10th week is a good idea to take the vaccine. If, even the influenza vaccine, if you are in that zone, like, you have those months where the influenza vaccine is at its peak, like June to August, October to December, January in the north and south. So that is the time, if you're pregnant, at that time, please take the vaccine irrespective of the time of pregnancy. Otherwise, you can wait up to 12th week if you're not in those months. Like now you're in the safer zone. So you can wait 10 to 12 weeks and then take the vaccine.
Right. Snehal has asked, she is in her 16th week of pregnancy. Her question is actually twofold, ma'am. And she's asking that, she's going through her first, pregnancy. And her worry is that she's not even got a single checkup once till now because of the lockdown. So she's really worried about that. And she's asking that, how do I get vaccination administered? And is there a certain, hospital or a place she should go to? Should she stay away from hospital where COVID cases are there? And those are some of her worries.
Can I know from which area she's coming in?
She is actually from up north, ma'am.
Up north, okay. So I just wanted to know whether she's in a city or districts, but whatever it is, I think today telecommunication is really, really very this thing. So I'm sure you can help her into getting into teleconferencing with any teleconsultation with the doctor, where she can have her thorough check, except for the clinical examination. most of it can be done on telecommunication. That's one. So that will relieve her a lot of her tensions. And even the lab tests are being done today, where people can just come to our house and collect her blood and do all the basic tests. And or she can visit a hospital which is definitely not admitting the COVID patients. So during pregnancy, we would definitely advise you to stay away from the red zone. So any hospitals which is falling into the red zone, please stay away from there. But if you are comfortable with a doctor in that area, you can do a telecommunication with the doctor over there. But try avoiding being there in a physical way. So no physical presence in that area. So this is much safer for you. Vaccination, don't worry. You have a long time to go. So I wouldn't worry about it.
Right. Ma'am, next question is from Rashi. And for everyone who's joined in, we are answering questions with Dr. Meeta Singh on vaccination during pregnancy. Rashi is in her 5th month of pregnancy. And उनका सवाल जो है वो हिंदी में है. मेरी प्रेगनेंसी का 5वां महीना चल रहा है. लॉकडाउन की वजह से हम लोग डॉक्टर के पास रेगुलर चेकअप्स के लिए नहीं जा पा रहे हैं. मुझे ये बताइए कि इस समय कौन कौन से वैक्सीनेशन करवाने हैं, क्योंकि मैं केवल एक ही बार जाना पसंद करूंगी, और आगे के लिए क्या वैक्सीनेशन करवा सकते हैं, वो अपने 5वें महीने में प्रेगनेंसी के. तो राशि, कुछ है कि सवालों के जवाब हम ऑलरेडी दे चुके हैं, डॉक्टर मीता दे चुकी हैं, बट डॉक्टर मीता, वुड यू वांट टू ऐड एनीथिंग टू व्हाट यू ऑलरेडी मेंशन्ड ऑन दिस?
या आई कैन से कि आपको अगर से आप 5वें महीने में हैं तो अभी आपको कोई गड़बड़ नहीं है वैक्सीनेशन के लिए, पर आप आपकी आयरन टैबलेट, कैल्शियम टैबलेट ज़रूर लेते रहिए. खाना अच्छे से खाना खाइए, अच्छा गुड फूड, हेल्दी फूड, आयरन रिच फूड, कैल्शियम रिच फूड, और प्रोटीन्स भी अच्छे से लेना है. जंक फूड अवॉइड करिए, और घर पे रहने के से आपका वज़न भी ज़्यादा बढ़ना नहीं चाहिए. ये बड़ी गलत सी बात है कि 2 के लिए खाइए, ऐसे नहीं है. आपको एक दिन में 300 कैलोरी से ज़्यादा आपके बच्चे के लिए ज़रूरत नहीं है, बिकॉज जब आपका बच्चा पैदा होता है वो आपका 2.5 to 3.5 kg रहता है, एंड बाकी सब प्लासेंटा और लाइकर से आपका थोड़ा सा ही वजन बढ़ने वाला है. तो आपको इतना ज़्यादा वजन बढ़ाने की ज़रूरत नहीं है, विच विल बी बैड फॉर यू. तो आपका वजन थ्रू आउट प्रेगनेंसी 9 to 11 kg से ज़्यादा नहीं होना चाहिए. तो ये आप घर में बैठे बैठे ये आप कर सकते हो. और दूसरा, वैक्सीनेशन का भी कोई गड़बड़ नहीं है. जब भी आप डॉक्टर के पास जाएंगे तब आप ये इन्फ्लुएंजा प्लस टीडैप, या अगर से टीडैप आप नहीं लेना चाहते तो टीटी तभी भी ले सकते हो.
Ravindra has asked a question. He's mentioned that because the COVID situation, his wife's flu and pertussis vaccination got delayed.
Yeah.
Is it okay to take both of them together in the next appointment?
Yes, of course. Yes. I think we have already addressed this question. It is quite safe to take Tdap as well as influenza all together at the same sitting. There have been enough studies saying that there is no problem.
Right. सनाया ने हिंदी में सवाल पूछा है पेरेंट्यून से. नमस्ते डॉक्टर, प्रेगनेंसी के दौरान वैक्सीनेशन के लिए क्या मुझे कोई और भी सावधानियां बरतनी चाहिए, और बजाय केवल वैक्सीनेशन इसके अलावा भी मुझे किस तरह की एहतियात बरतनी चाहिए, प्लीज बताइए.
या वैक्सीनेशन तो हमने काफ़ी वही रिपीट करा है कि क्या क्या लेना चाहिए, एंड बाकी सब तो आपको इन्फेक्शन अवॉइड करना चाहिए. इसके लिए जो हाइजीन है, अपना हाइजीन बड़ा इंपॉर्टेंट है. ये थिंक आप गवर्नमेंट ने भी बड़े अच्छे से काम कर रहा है कि आप फोन उठाते ही आपको बताते हैं कि आपको क्या क्या करना चाहिए, और कंटिन्यूसली आपके हर मीडिया पे, आपके हर इसमें आपको पर्सनल हाइजीन कैसे मेंटेन करना चाहिए. ये यूनिवर्सल जो हाइजीन है ये बड़ा इंपॉर्टेंट है हर इंसान को, और प्रेगनेंसी में और ज़्यादा, एंड बच्चों के लिए भी बहुत इंपॉर्टेंट है. इसके अलावा जब हम फ्रूट जब लेते हैं, वेजिटेबल्स जो हम खाते हैं घर पे, उसको डेफिनेटली अच्छे से वॉश करना चाहिए. कुकिंग, रॉ फूड बाहर से नहीं खाना, वेल कुक्ड फूड लेना है. एंड अभी तो कोविड के बारे में मैंने बताया कि आपको ये सोशल डिस्टेंसिंग जो बहुत ज़्यादा इंपॉर्टेंट है. और प्रेग्नेंट वुमेन, ओल्ड पीपल, यंग चिल्ड्रन घर के बाहर लॉकडाउन के बाद में भी मत निकलिए, unless and until it is really necessary. So this is the advice till we get a vaccine for COVID. Pregnant women, old people, small children, please do not go out of the house. Stay safe.
Right. Thank you, Dr. Meeta. So next question is from Durga. Durga is asking that my wife is vaccinated with NH strain influenza vaccine in January.
Okay.
Should she take further SH strain in this time, or should they wait?
Yeah, I think if you have just taken in January, we can wait, though the strains keep changing. That's a very good question. The strains do keep changing, but there is some cross reactivity. So the antibody titers are quite okay. So I think we can wait. There's
Okay.
going to take another one.
Okay. So just for everyone who's joined in the session late from Parentune, I would just want to again highlight that we are today joined with Dr. Meeta Singh, and we're taking questions on vaccination during pregnancy. Vedanshi Singh from Parentune has asked, she is in her 22nd week of pregnancy,
Mhm.
and she's already taken the 2 shots of tetanus, and she's taking Calcimax and atrium tabs. As all the OPDs are closed right now, she's not able to visit her doctor.
Yeah.
She's asking, please guide me how to move ahead with different tests, especially level 2 scan. And that was done, level 2 scan was done on 28th March. So how does she go ahead for the rest of the test? What are some of the precautions she should take?
Yeah. So I think you should be continuing with your iron and calcium, but I would prefer that you add on a little bit more of your vitamin D, because Calcimax has only about 400 IU of vitamin D. So you would need about 1000 IUI of vitamin D. And 2000 per day is what we are giving just now. So just recheck that calcium content that you're taking, and perhaps that is the advice by the organizations that we need to give about 1000 to 2000 IU of vitamin D during pregnancy. I think that you need to take care. Yeah, I can understand your concern about the 20th week of pregnancy. We would ideally like to do a scan around this time. This is called the second trimester TIFA or the late TIFA, where the organs are better developed of the baby, and that gives you a better picture of any problems that can arise in this time. So even during the lockdown period, the what rules we were following was we were allowing our women to come in for the NT scan, that is the 12th to 13th week scan, the TIFA scan, that is around the 18th to 22 week scan. So I think you can approach your obstetrician or the diagnostic, where you can go and do these tests, take all the precautions.
Thank you, Dr. Meeta. Kavya has a question. She is in her last trimester, and while her last checkup happened in the 5th month, and she's got her vaccinations done for Tdap as well, she's right now worried about contractions, and she's saying, how should I take care, and what are the precautions I should take for keeping in mind that I'll be entering soon in my 9th month, and until especially she reaches an hospital given the COVID situation.
Yeah, actually, I lost your voice in between, but I think I can understand. If I can, just correct me. Uh, she's asking if she gets contractions, how to go and how to understand whether it's a contraction, isn't it?
Right.
This is
And
a
what precautions should she take?
yeah. I think precautions like the same precautions that I have told you earlier. Use that face mask, and of course the social distancing. Don't go out unless it's necessary, so you are protected even otherwise from catching an infection. And at home also, anybody who comes in from outside, you should not be exposed to them directly, and they also should take care. All the old traditions that we have: leave the slippers outside, wash your hands, wash your face, change your clothes when you have got outside, and only then come in contact with you or the children or the elderly at home. These are universal precautions for everybody, so that way you are protected from the COVID, because COVID need not necessarily present with a problem. They are called asymptomatic carriers. So you may be absolutely normal, but you could be carrying the COVID virus. So that is how you're going to protect right from your home. And then when you're protected and you're sure that you're not suffering from a problem, what you have to do when you go out is have that plastic shield, because if you've got that plastic shield, the face mask is not sufficient. The plastic shield is going to prevent any droplets from getting into your face, and you yourself will not keep touching your face. So this is a greater advantage than just having a mask. So have a mask, have a face, so you're doubly protected, and a sanitizer when you go to the hospital, and maintain that social distancing, and the hospitals will take care of you once you're there. To see to it that you're protected. And coming to the second part of the question, you can have little contractions on and off throughout after the 36th week. They are called the Braxton Hicks contractions. But what you really need to do is, if you're contracting regularly, that means say once in every 15 minutes, or if you've passed sudden leakage of water, or there is a reddish discharge, or if your fetal movements are not really good, if you're not feeling the movements well, at least one movement and half an hour, definitely you will find. But if you don't find, another half an hour you can monitor. 2 hours you don't find anything, these are the time when you have to go to the hospital. And you're not going to deliver in an hour or two, you're given enough time, so you'll have enough time to go to the hospital.
Right. And the next question is, when should a mom actually look at vaccination after, or after pregnancy? Is there something which a mom needs to get vaccinated for, especially in the last trimester or just after it?
Yeah. So last trimester, I told you around 36 weeks is 28 to 36 ideal time for your Tdap. And in case you have missed all those vaccinations, you can still take your Tdap just after delivery, because that also is going to protect the baby in the first 6 weeks. So if you have missed out that Tdap vaccination during pregnancy, you can take it immediately after delivery. You don't have to wait. Anytime you can take it, because the first 6 weeks, the baby gets infected more frequently from the mother. So mother is the reservoir of infection. So you take the Tdap, even then you're protecting your baby. That is one. Second is, we are very aggressively, we promote HPV vaccination for cervical cancer at the 6th week of pregnancy. Hepatitis B, if you have not taken, take the hepatitis B vaccination. Both these prevent cancer, cervical cancer and liver cancer. Hepatitis B prevents liver cancer.
Right. Chetan has asked that, can you tell me how does pertussis vaccination affect my newborn baby, and why is it so important for my newborn baby?
Correct. Pertussis vaccination, if you're giving to the mother in this 28 to 36 week, or if you're missed out later half of pregnancy, that is going to protect your baby from pertussis in the immediate after birth to 6 weeks, because the antibodies which are there are going to be passed down very silently from the placenta to the baby. So even if the baby is getting affected by the reservoirs at home, the baby can get infected from the mother, the baby can get infected from the grandparents, from the house help, from the siblings. So these are the sources of infection for the small child. So if the mother's antibodies are sent to the baby can fight this infection well. So I think it's very, very important to take the Tdap. That's how it's going to protect the baby with the vaccination. And in fact, it is a good idea for the grandparents to take the vaccine. That is called the cocooning effect. So the grandparents, the siblings, the help, everybody who's exposed to the small baby should be vaccinated. That would be an ideal situation, but that's, a far thought for us right now.
Right. The next question is from Ramya, who's in her 25th week, that she's already got one dose of the TT injection till now. Should she now go for Tdap? Is it okay?
Absolutely. I mean, I would strongly endorse it.
Okay. All right. And then there is a question around the whole bit from Moni in her 33rd week. And she's asked that, is it safe to go out for a checkup during COVID to a government hospital? Does it make a difference to go to a private hospital? What are the vaccinations, especially in the last trimester? So for the vaccination in the last trimester, Dr. Meeta has already covered Moni through the session. So look at the video. On this entire bit of government hospital and private hospital, Dr. Meeta.
I know, definitely. I think it's a very, very, very practical and a very relevant question to be asked. So I think what you should be doing is, if a government hospital is not admitting the COVID patients, that is the place you can go. And that is the place where you can go for your checkups, because they are segregating. The COVID wards are totally separate and the non-COVID wards are totally separate. And I must tell you, the government hospitals are doing a fantastic job in this time. Right. And because I have personally actually visited a COVID ward, and I was amazed at the excellent work that our doctors, our personnel are doing at this time. I mean, hats off to the government doctors and the health personnel who are working there. And they are keeping everybody, the non-COVID, also safe. But you don't have to go, you don't go anywhere, whether to private or to the government hospital, unless it's really, really necessary. You can go for a tele consultation. And before you, I'm very surprised that none of the viewers asked me this question. So before we run out of time, I want to answer this question, very important question. Nobody has asked whether vaccination is safe for the baby.
I think you should definitely answer that question.
Yeah, so I was waiting since nobody asked. I'm going to elaborate a little bit on that. Vaccination, all these vaccinations that I've spoken of is very safe in pregnancy, and there are enough of studies to say that. And I told you what are the vaccinations that should not be taken, and even the purchases, the one which is for the pregnant lady only, that is the vaccination to be taken, not the one which is given for the children. And there has been some talk, there were some patients who were very concerned whether vaccination causes autism. But there is good information to say that is not related. So the world authorities have said that there is no relation to autism and vaccination.
So this question is on Tdap, and it is about that, this mom has taken 2 doses of Tdap already in
T-
her of Tdap. And now she's asking, should she take Tdap in the 3rd trimester as well, or is she sorted now?
No. I didn't understand. Has she taken Tdap in the previous pregnancies?
So she's mentioned 2 doses of TD. I think maybe she means tetanus. Maybe she's taken TT shots.
Yeah, no. Yeah, if you have taken 2 doses of tetanus shot, you can still take a Tdap, no problem.
Okay. So, and it can be taken in the 3rd trimester,
Yes,
right?
in the 3rd trimester. Another thing that I would like to add is, supposing you have taken a Tdap in your previous pregnancy, you still need to take 1 dose of Tdap in your present pregnancy.
Okay. And if Zahir Khan has asked that if already taken Tdap vaccine in first pregnancy, is it going to offer protection in the next pregnancy, or should they take
I
it?
have just answered this question that you need to take it again.
Okay. So this is actually important to sort of remember that for each pregnancy, it's important to be taking these vaccines, right?
Because the antibody titers are not going to last, for the next baby.
Right.
Levels of the antibodies which you have taken in the last pregnancy, that is not enough to cover that immediate newborn. So you need to take it again between the 28th to 36th week to have that antibody levels, which is going to protect your newborn. So you need to take it again.
Okay. All right. Thanks for answering that, Dr. Meeta. So we are now towards, towards the latter part of the session, and maybe we'll spend the last 5 to 7 minutes in highlighting some of the things which we've been talking today. So I'm just going to invite Dr. Meeta to highlight some of the things. And Dr. Meeta, I have just one request. If you can also, in the conclusion part, if you can also share the same tips which you were talking about for COVID, like, being conscious of which zone is the hospital in and things like that. So if you can talk about some of the crucial things about vaccination during pregnancy, care which every expecting mom should be taking during this time, whether be it at home or being, stepping out of their houses for vaccination or any kind of test. So Dr. Meeta, if you can, spend 5 minutes talking about this would be great.
Sure. So 2 areas, though it's not a part of the session, but I think it's a good idea to talk about both of them. Vaccination in pregnancy, I think we have talked enough, so I'm going to be very quick on that. Just remember 2 vaccines that you need to take during pregnancy. One is the influenza vaccine, which can be given at any time during pregnancy. So you can ask your obstetrician, and it is safe to take it any time during pregnancy. But some studies have said that if you take it in the later half of pregnancy, the baby is better covered up to the 6 months of pregnancy from swine flu. So that is going to help protect the mother as well as the baby from swine flu, because swine flu is very bad during pregnancy for the mother. So influenza has got a huge influence on protecting the mother, on protecting the baby. Coming to Tdap, tetanus is actually no longer there. We are not even seeing neonatal tetanus. We are not even seeing the tetanus in the mother. So actually tetanus is going to get weaned off like polio after some time. But today we are still taking it because we don't even want to encourage those ad hoc cases, very rarely which we find. So unless it is totally eradicated, we are still going to continue to give the tetanus injection. But I think more than the tetanus, in today's world, you need the influenza, you need the diphtheria, you need the pertussis. The pertussis is much more important than tetanus for children today. Even if you have not taken your tetanus, doesn't matter. It is the pertussis which needs to be taken. and which has to be given, because that's going to prevent the neonatal tetanus, where neonatal pertussis, because the babies are not protected by their own antibodies immediately 6 weeks after delivery. So immediately after delivery, the baby's immune mechanism is not strong enough, is not mature enough to develop the antibodies. They'll develop an antibodies only after the 6th, 7th week of pregnancy, after delivery. That means if they're exposed to a natural infection or from anywhere, either the antibodies have to come from the mother, which is protecting them through this vaccine, or they have to develop it on their own. So the first 6 weeks is very, very important. Pertussis is very, very important to take. Diphtheria is important to take. Now, all three come on. Tdap is a single injection which will cover you against tetanus, against diphtheria, against pertussis. So you have to take influenza, you have to take Tdap. Tdap, best time to take is 28 to 36 weeks. If you miss it, don't worry. 1 week before delivery, you can still take it. Post, you have missed all that, you can still take it at delivery. You can still take it 1 week after delivery. So this is the take on the vaccination in pregnancy. COVID, stay home, stay safe, unless there is a need to go out. So pregnant women, don't go out unless it is an emergency. All your consultations, please connect with your obstetrician on phone. Video consultations are available. Now, Government of India has allowed telemedicine as a medico-legally. We are allowed to prescribe medicines on phone, which we were not allowed earlier. Because of the COVID scenario, medico-legally, it is accepted where a doctor can consult on phone, a doctor can consult on video. So please do that unless you need to be seen physically. 2 times where you have to go to the doctor, very important, is the 12th week scan and the 20th week scan. Forget about the extensive battery of tests which would you normally undergo unless there is a problem, because protection against COVID is more important than picking up a little urinary infection or little problems here and there which you have, which can be easily corrected at home. So drink a lot of water in the summer, plenty of water, positive mind, positive thoughts, don't put on weight, eat healthy diet. If you're beyond 20 to 24 weeks, sleep on the left side and be healthy. So when you go out, use a plastic shield and the mask, and carry the sanitizer, maintain the 3 meters distance, and I'm sure you'll be safe.
Thank you, Dr. Meeta. So I am taking away, personally, I am taking away 2 do's and 2 of them from you today. And I promise you that we'll be doing them very soon, especially for, expecting moms. First is that, what precautions to take while going to the hospital. I think we'll also take some of these pointers which you've shared with us, and what should expecting moms be actually taking as precautions. And the second is that this entire thing of making this plastic shield at home. So we'll make sure that we do a DIY video on Parentune for this, and so that all the parents can actually pick up from that. Thank you everyone who joined from Parentune with all your questions today. I hope that you've seen the video and you've actually taken a lot away from this really informative session. Dr. Meeta Singh was with us today on this session. She's a very senior gynecologist and she joined us from Hyderabad to take these questions. Ma'am, I would like to thank you especially for all the patient replies you've given to all the parents. You've also answered them in Hindi. I'm really grateful for that. From Parentune and everyone at Parentune, we want to give you a big thank you, and also we want to wish you on the eve of Mother's Day a very happy Mother's Day. I would also want to thank GSK for supporting in this initiative and bringing this live to all the parents on Parentune. I would like everyone who's watching this session from Parentune to take good care of yourself, make the most of the weekend to make sure that the mom of the house tomorrow has a special day. If not already till now, I'm sure you're sharing the load with the mom of the house. So make sure we continue doing that through the COVID period and even after the COVID period. These are great times for us to share the load with her. Also, I would want to inform everyone that we'll continue to bring more such live sessions on Parentune to support you. And we'll bring forward more experts. Also, we'll be doing these live sessions with them on various topics. And What I would also want you to do is join us on 11th for another session on vaccination. It would be a live session on 11th. And enjoy your day tomorrow. Do join us tomorrow at 5 p.m. at your balconies and windows to thank the moms, the home warriors. We've done that for the healthcare workers, to doctors. It's time to say thank you to moms also. So see you there tomorrow at 5 p.m. On your balconies, saying a big thank you to moms. And stay tuned and take good care of yourself. Please be healthy and please stay home and stay safe. Thank you, everyone. And thank you again, Dr. Meeta, for this lovely session.
Thank you so much, and goodbye and namaste to all the viewers.
Thank you, ma'am. And see you, everyone.